Assalamualaikum warahmatullahi wabarakatuh. I would like to say thank you for coming in my presentation. It's great to see you all. Let me introduce myself. My name is Fani Eka Septiana and I'm from Temanggung. Here I am as a presenter on this research and my correspondent author, Mr. Prasojo Pribadi. In this Borobudur International Symposium 2020, I want to present my research, a survey of community perceptions and knowledge toward antibiotic resistance, case study from Magelang, Indonesia. And now we are going to present about this research. Then, this introduction. Antibiotic resistance is one of the biggest health threats in the world, especially in developing countries including Indonesia. The negative effects of antibiotic resistance are increased mortality rates, require longer time for therapy, and decreased functionality and the need for post-acute care. The result of research conducted in Indonesia showed that of 781 patients in the hospital, 81% had resistance with ampicillin and cotrimoxazole against Escherichia coli. The factors that influence antibiotics are the inappropriate use of antibiotics, the low level of patient knowledge in the use of antibiotics, and the level of patient's income. Several studies in Europe show that increased antibiotic resistance is related to high use in the community. This is caused by irrational use of drugs and lack of education about antibiotics for patients, while from several studies in developing countries show high use of antibiotics without a prescription. Knowledge about how to use antibiotics is not enough if it is not balanced with awareness of the dangers of antibiotic resistance. Knowledge of antibiotic resistance can foster awareness to change in people's behavior in using antibiotics properly. Therefore, this study aims to examine antibiotic resistance in Central Java, Indonesia. The study was this cross-sectional survey was carried out from October 2019, and the research design was a descriptive analysis to assess the perceptions and knowledge of people in Central Java about antibiotic resistance. A total of 455 respondents were used in the study. Inclusion criteria include respondents older than 18 years old who could speak Indonesian and were domiciled in Central Java. A questionnaire was prepared to collect data consists of 6 parts. They were asked to rate on a 4-point Likert, like a scale from 1 fully disagree to 4 fully agree degree. We adapted the questionnaire from Carter, and a pilot study was conducted on 10 respondents to find out the simplicity and clarity of the questionnaire, detecting ambiguous language and the level of understanding of respondents. Then, Table 1 shows the demographic profile of the respondents. Female respondents being the majority of respondents in this study. There were 69.9% respondents, while male respondents were only 30.1%. There were 91% respondents aged 18 to 29 years who dominate in the study, and a minimum age of 50 to 64 years only 0.7% of respondents. The most respondents were 62.9% senior high school students. The highest level of income was less than 1,500,000 and the number of respondents was 65.1% because the majority of respondents were still students. Based on the research, it showed that people in Central Java suppose the several symptoms can be relieved by antibiotics. Approximately more than 10% of respondents believe that antibiotics are the best choice to treat fatigue, 5.5%, cough, 8.8%, fever, 26.5%, and runny nose and sore throat 25.5%. The some research were mentioned in a research conducted by Dadari explained that as many as 25.27% of respondents believe that antibiotics are used to treat fevers, colds, bacterial and viral infections. Meanwhile, antibiotics are used to kill bacteria or prevent bacterial proliferation. Therefore, it can be seen that public knowledge about the use of antibiotics is lacking. Public knowledge should be encouraged because inadequate knowledge can lead to misunderstandings and inappropriate use of antibiotics. The research showed there are 72.3% of respondents know the term antibiotic resistance and 27.7% respondents did not know the term antibiotic resistance. However, as many as 43.7% of respondents cited that they had never heard of the term before. In the study, most of respondents chose medical professionals as a source of information about antibiotic resistance. The assessment of people's knowledge and perceptions in Central Java found that 56.30% of respondents acknowledged that inappropriate use of antibiotics could encourage. In Figure 2, most of the respondents in this study trusted their doctor or nurse about the need for antibiotics to be consumed by them. 53.8%. This shows that adequate knowledge from health workers can lead to confidence for patients to be obedient in taking antibiotics. In Figure 3, the majority of respondents, 51.9%, agreed if they had to take antibiotics that had been prescribed. A total of 14.9% of the respondents disagreed, and 9.9% agreed if there was no relationship between taking antibiotics and developing bacterial resistance. Most respondents, as many as 14.7% disagree if there is no problem how many days antibiotics are taken, and 6.6% respondents agree. The research in the study, there are 44.55% of respondents agreed with the statement about antibiotics can kill bacteria, and 38.9% of respondents agreed that antibiotics can kill virus. The limitation of this study lies in the small number of samples data obtained from one region. Therefore, this research cannot generalize. Based on the results of the analysis in this study, show that the majority of respondents know about antibiotic resistance. Therefore, the public has the perception to use antibiotics properly according to doctor instructions. The role of health work in the providing information related to antibiotic use and resistance is very important because most respondents fully trust the advice of doctors or other health professionals. In conclusion, the existence of knowledge about antibiotic resistance can foster public awareness to be more aware of the dangers resistance. It can change people's perception and behavior to use antibiotics appropriately. Therefore, possibility of antibiotic resistance problem in Central Java, Indonesia can be reduced. Then this reference, and thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.